Today, we're talking about Clonidine, a medication that, a lot of people have probably heard of, but what you might not know is its absolutely fascinating journey from what was basically a failed experiment to a real modern medical workhorse.
It's a bit of a riddle, right? I mean, a stuffy nose and trouble focusing, they don't seem connected at all. But the answer, believe it or not, lies in one surprisingly versatile little molecule.
And there it is, Clonidine. It's the bridge connecting that failed nasal spray from the 60s to modern treatments for both the heart and the mind. Its story really tells you so much about how medicine evolves, and, a lot of the time it's completely by accident.
Okay, so let's dive into the story. Because to really get what Clonidine is all about, you have to go right back to the beginning, which it turns out was not at all where its creators thought they were headed.
So the story kicks off back in 1961. Clonidine was originally made to be a nasal spray, but, well, it didn't really work. But then researchers noticed this really unexpected side effect. It was dramatically lowering people's blood pressure. So by 1966, it was completely repurposed. And fast forward to today, it's a super common drug used for a whole range of issues. So how can one single drug do two completely different jobs? It seems kind of weird, right? Well, let's break down its two primary missions: getting high blood pressure under control and helping to manage ADHD. Okay, this is where it gets really cool. For high blood pressure, Clonidine works down in the brainstem. Think of it like it's turning down the volume on your body's fight or flight system. That relaxes your blood vessels and lowers your heart rate. But for ADHD, it targets a totally different area, the prefrontal cortex, which is like the brain's command center. There, it helps strengthen the important signals for focus while dampening the distracting noise.
Pretty clever, huh?
All right, let's switch gears and get practical. If you or someone you know takes Clonidine, this next part is absolutely essential for using it safely and making sure it actually works the way it's supposed to. So, Clonidine comes in a few different flavors. You've got your standard immediate release tablets, which are often for blood pressure. Then there are the extended release tablets, which are specifically designed for ADHD to give a nice, steady effect all day. There's even a skin patch you just put on once a week and an injectable form that's only used in hospitals. And this is so, so important. Your dose is tailored specifically to you. You should never ever crush or chew the tablets, especially those extended release ones, because that just messes up the whole system. And it's critical to know that these different forms are not interchangeable. You can't just swap one for the other. Of course, like pretty much any medication out there, Clonidine comes with potential side effects. So we're going to look at the common ones that a lot of people experience, and then the rare but much more serious ones you really need to watch out for. So if you look at the data from the clinical trials, the most common things people report by far are drowsiness, that's the somnolence, and just general fatigue. Dry mouth is also super common, but here's the good news. For a lot of people, these side effects tend to get better as your body gets used to the medication over the first few weeks. Okay, but on the flip side, these are the serious red flags. If you experience anything like hives, any kind of swelling in your face or tongue, or you have trouble breathing, that's a medical emergency. Same goes for fainting or feeling severely dizzy. Don't wait, call your doctor or get help right away. We are now moving to what is, without a doubt, the most important part of this entire discussion. These are the warnings that everyone who takes Clonidine or knows someone who does absolutely must understand. And look, don't just take my word for it. This is a direct warning from the U.S. Food and Drug Administration. Suddenly stopping this drug can trigger a massive, and I mean massive, and dangerous spike in your blood pressure. This is called rebound hypertension. Basically, your body gets used to the drug being there, and when you suddenly take it away, it just completely overreacts. This can be incredibly dangerous. That's why, and I cannot say this enough, you must never stop on your own. Your doctor will always create a plan to slowly and gradually taper you off of it safely. The second critical warning is all about its sedative effects. Look, Clonidine can make you drowsy all by itself, but when you combine it with things like alcohol, opioids, or other drugs that make you sleepy, that effect gets amplified a lot, and that can be really dangerous. So let's just break this down. With other depressants like alcohol, you're looking at extreme sedation. With a class of antidepressants called tricyclics, they can actually work against the Clonidine and make it less effective. And if you combine it with beta blockers, another common blood pressure med, it can cause your heart rate to drop way too low. Whew, okay, we have covered a lot of ground, from its accidental history all the way to its biggest risks. So let's just boil all of this down to the most important things you should walk away with.
Okay, first, it's an incredibly versatile tool, handling both high blood pressure and ADHD. Second, while side effects like being tired are really common, they're usually manageable and often get better with time. But third, and this is the one to tattoo on your brain, is the golden rule. Never, ever stop suddenly. Always talk to your doctor to come off of it safely.
You know, Clonidine's journey from a useless nasal spray to a life-changing medication really makes you wonder, doesn't it? As we get better and better at understanding the brain's complex chemistry, what other common drugs, already sitting on our pharmacy shelves, are just waiting for a second chance to surprise us all?